Good afternoon, ladies and gentlemen. Welcome to the General Government Budget Committee, quite possibly our last meeting of the session. Don't cry. It'll be okay. Absolutely not. That's inappropriate. All right. Today we have from the Children's Cabinet, the Executive Director of Melissa Rooker, who's going to be providing some information as to the key fund and transfers and just everything under the sun. Take it away, Melissa.
Thank you, Mr. Chair, and I do appreciate the invitation to just come do an informational briefing and stand for questions, because I know there have been some in the committee, and I think it would be excellent to have a conversation with each other. My father's in the hospital, so I'm going to stay masked for his protection, but we'll try and get through this juggling glasses and masks. Always fun. So there are a couple new faces on the committee. Some of you are veterans who understand and have worked with the Key Fund and the work that we do, but I thought it might be nice to start with just a general informational briefing. So if I may, the Children's Cabinet was created in 1999 through legislative action. Kansas was the first state in the country to create a children's trust in 1980. And then in response to the state participation in the master tobacco settlement, we, the legislature at that time, made some value judgments about how to spend and direct those funds. So they put that into statute. So what I first wanted to walk through is just the suite of statutes that created us, that outline our responsibilities, and the role that both the Kansas Endowment for Youth, which those statutes created, and the Children's Initiative Fund play according to Kansas statute. So the first one, and I'll cite, so it's 38-1901 is the organizing statute. That created the cabinet. It outlined the membership. So we have a governing board that is appointed by both legislative leadership and the governor in 4-year terms, and they're kind of staggered. There's requirements. The governor gets 5 appointments, and then House Speaker and Majority Leader or Minority Leader, the Senate President and the Minority Leader on that side, each have an appointment. And the governor's appointments have to be divided, so there can be no more than 3 from a single political party at any given time. So we work through that with the Secretary of State's office help to register appointments and do all the proper things. Our voting board then is 9 members strong, and then there are 6 positions on that board that are ex officio. They are the advisors, and they represent the court system, the Board of Regents, the Department for Children and Families, Department of Education, the Department of Health and Environment, and Department of Corrections for the juvenile justice side. So the secretaries are technically the ex officio members, but they are allowed to send designees. But we work very closely with our supporting agencies. 38-1901 in Section G outlines the duties and functions of the cabinet, and I put those in the testimony, so I'm going to not dwell on them in the oral testimony, but we have the language in the testimony that I provided is directly taken from statute. So you can see that it really involves coordination and collaboration and identifying gaps and barriers and recommending different actions that can help facilitate that cross-agency collaboration that is envisioned. The next statute is 38-2101. That is the statute that creates the Kansas Endowment for Youth and defines how such monies will be used. So the endowment is designed to be the receiving vehicle for the tobacco settlement annual distribution. And the original intent was that it would build up an actual endowment that could then, through investment by the KPERS board, that the endowment would be a corpus that would create income based on investment earnings. We've never really achieved that level of volume in the Key Fund. Since inception, there have been a variety of reasons why there have been sweeps from Key Fund, but it is designed to receive the tobacco settlement funds and then transfer money annually to the Children's Initiative Fund for the purposes outlined in 382102, which creates the Children's Initiative Fund and outlines the purposes and requirements for funded programs. So we are directed in statute that when allocating or appropriating money in the Children's Initiative Fund, that the legislature shall emphasize programs and services that are data-driven and outcomes-based, and may emphasize programs and services that are generally directed toward improving the lives of children and youth. It goes on to define that programs funded must have a clearly articulated objective to be achieved with any funds received. As a condition precedent to funding, every program must demonstrate that the program's design is supported by credible research, that the program as implemented will constitute best practices in the field, that data is available to benchmark the program's desired outcomes, and that an evaluation and assessment component is part of the program design, and such evaluation is capable of determining program performance, needed program modifications to enhance performance, ways in which the program could be modified for transfer to other venues when performance no longer justifies funding. And then there's a clause, we're not supposed to use the money allocated to CIF, as we call it, to supplant money that was in the prior year with state general fund dollars. Obviously, there are ways around those things. The word notwithstanding has a lot of power, and that has happened. So there have been, for a variety of reasons, transfers over the years that don't align with the statutory guidance. But the cabinet takes a great deal of pride in the role that we play in coordinating the evaluation process and the accountability side of this. So we are, let's see, it's 382103 that outlines duties concerning the CIF, that says the Kansas Children's Cabinet shall review, assess, and evaluate all uses of the monies in the Children's Initiative Fund. The Cabinet shall study and shall initiate studies, assessments, and evaluations by contract or otherwise through institutions of higher education and other appropriate research entities to identify best practices and to measure and otherwise determine the efficiency and efficacy of practices that are utilized in programs, projects, for which monies are allocated or appropriated from the CIF. The cost of such reviews, assessments, and evaluations shall be paid from the Children's Initiatives Accountability Fund. So this was important enough that the legislature has a line item that supports that process of evaluation. And I would point out that over the years, long before I came on board, there were a variety of steps taken to create what we call the accountability process. And it involves both Wichita State University and the University of Kansas Center for Public Partnerships and Research as our university research partners. They track both the program effectiveness and just basic data that tells us how many are served and whether we're seeing the right outcomes. And the cabinet has used that information annually to guide the recommendations for funding. In 382104, it speaks to the purpose of the endowment, that it's invested in reinvestment, invested to achieve the objective of the preservation of funds. So it's a lot of guidance for CAPERS because their board guides the investments. And then finally, 382105 requires our annual report. So it's actually the CAPERS report on the investment side. I wanted to talk a little bit about what that accountability process looks like. In 2014, the governing board adopted what we still employ today. It's called the Blueprint for Early Childhood. It focuses on healthy development, strong families, and early learning. So within those three pillars, there's criteria that we look for in programs that are funded. We have a model that at that time was adopted called the Common Measures Initiative. And so I'll get into the specific programs that participate in the Common Measures, and that is what it sounds like. It's a toolkit that has a set of 5 or 6 different assessment tools that programs, they don't all apply to every program, but it's a universe of assessments that allows us to do some good comparisons between programs and across multiple years. And then for that applies to one of the line items in the CIF, which is called the Early Childhood Block Grant. ECBG is that acronym for short. That is the one component of the CIF that our governing board actually determines grant awards out of. The rest of it is made through legislative action. So the CIF line items are appropriated in the budget process, and we collect information and data for our annual report from every CIF funded program. But at the pleasure of the legislature, the CIF is determined. But I want to talk a bit about what those programs and evaluations look like. So Common Measures is used to determine quality of classrooms. If it's a preschool classroom, we have a couple measurement tools that measure early literacy and numeracy skills. So our kids learning numbers and letters and getting the kind of preparation that will help them start kindergarten on track and ready to be successful learners. There are parent education programs that are supported. So there are some assessments that help determine, that help parents know if they're their kids are developmentally on track. There's tools that assess the quality of the learning environment. So it depends on the type of program, which measurement tool is used. We use an RFP, so it's a public application process. We annually issue a request for proposals. We do a lot of work to make sure that we are offering public information through our website. We host webinars. We post webinars for people who can't make it live in person. We offer office hours. So my program director is available to help programs with questions about whether or not they might qualify. And it's a very open process available to anyone statewide that wishes to write a grant application. There are criteria that the cabinet put in place for what the early childhood block grant, criteria that programs need to meet. So we look for public-private partnership. We look for community-driven projects that have local partners. We want to work with nonprofits. So that's a requirement. And we have to have, there's got to be some local match, and programs need to agree that should they be awarded, they will participate in our evaluation process. So all of that gets reviewed by an independent review committee. We have a rubric, we score them, and it's a process that is done by an independent team. And then the Children's Cabinet at our April meeting will receive a slate of recommendations and make determinations about the next year's slate of grant awards. This year, we are partnered in a trial project with the Department of Education to see if we can make comparisons between our early childhood block grant and the Kansas preschool program, which is also a grant program at this time because there's not enough funding to just go forth and fund every preschooler in the state, but there's grant funding provided by the legislature. So we have been working to align criteria and applications, and we worked together on a budget template because the goal was to make sure school districts were using the funding available in the formula through special ed, through other things that first dollar in to fund their preschool classrooms. And then ideally, if the Kansas preschool pilot, that program is available for certain grants, and there may be, and we have seen some school districts that had grant proposals that were better suited, frankly, to the early childhood block grant because they were more wraparound services than we're not funding the teacher in those classrooms, for instance. So we are in the final phase. We'll bring forward a slate of recommendations to the cabinet for the April meeting. And then the cabinet uses the June meeting to receive the annual accountability report. And based on those findings, we then hold a discussion to make budget recommendations to they flow through the Department of Education budget and to the governor the budget office in September, and then into the governor's budget recommendation if the governor so chooses to follow. It's a process that has been cited favorably in a number of reports over the years. So the Alvarez and Marsal study in 2016 singled out the process the cabinet uses as a standard to emulate in other programs in the state because of the rigor, the transparency, and the fact that the cabinet over the years has been willing to say, we're not going to just automatically renew your funding, and we have used that process to gauge the performance of programs. So we also are in compliance with the performance-based budget requirement for state agencies, which is something that we're proud of because there really wasn't much of an adjustment for us to make when that passed. Interesting to me, there was a legislative post-audit study done of the Department of Commerce programs, I think 2 years ago, that also pointed Commerce to the process used at the cabinet as a model for their economic incentive programs to begin to put some kind of process in place to evaluate the ROI of those programs. We have a couple others. So that CIF budget, I will say, has no state general fund dollars. It's all tobacco fund. The cabinet also serves as the state lead on 2 federal grant programs that don't have any connection to the state budget. So we're the state lead for a program called the Community-Based Child Abuse Prevention Program, which is about $1 million, give or take. It's been less this year. It's 1.2. So there's a window based on the federal allocation and a formula they have. That is a program with specific federal criteria from the Administration for Children and Families that requires us to focus on programs engaged in primary prevention, which is practices that are way upstream, long before a child is subjected to abuse or neglect or maltreatment. We're trying to invest in programs to prevent that from ever happening. And annually, the program has certain goals and criteria that we as state lead are asked to meet. And then we have a 3-year grant that we're rounding the corner on year 2. We have one more year. It's called the Preschool Development Grant, Birth to 5. And that one has been a collaboration between DCF, KDHE, KSDE, and the Cabinet. The Cabinet applied as the state lead. And so we have been hard at work on this grant is designed to implement systems level improvements, and so better coordination among the various funding programs that separate agencies have, just trying to improve operations at that level. We also, as a cabinet, I should mention, during the CARES Act, the Spark Committee named the cabinet to run a program that was called Technology for Families, which was a way to, in that immediate spring 2020 crisis, it was a little bit of funding so that we could give families devices and data cards so that they could connect virtually to the things they needed to engage in during the shutdown. And that was, it's in my annual report last year. I think it was 1.7 million all told. And then we had a program that ended up spending 15 or 16 million. It was called the Remote Learning Grants. And it was then Senator Denning had a proposal for Spark to create a grant that would help programs stand up safe places for kids who were in remote learning situations whose parents had to work. They needed childcare, they needed safe environments, and they needed their kids to be able to connect to school online. So we gave grants, and it was everyone from home-based family licensed childcare providers with 3 school-age kids, but they needed whatever, internet or a desk or whatever kind of thing, to YMCA and Boys and Girls Clubs to help them expand from just after-school programs to all day. And so those both closed out last year at the deadline for CARES Act. And that is the sum total of pandemic relief funding that the cabinet has been involved in to date. I know that's a lot, and I know that there's a lot more that I could continue to talk about, but I promised an opportunity to open it up for questions. So ask me anything and we can have a conversation.
Good, thank you. I do have one question. You mentioned that the Children's Cabinet Trust Fund was originally supposed to be kind of an endowment. How far along has it ever gotten above a zero ending balance?
I know I have a spreadsheet. You've seen my spreadsheet. There were some fairly sizable fund transfers in times of budget stress, and it's the Great Recession is one example. I think 2014-15 timeline in state budget history is another, where there were sizable portions. The line items in the key fund that transfer to the Attorney General and the Department of Revenue exist to fund the compliance activities that the state is required to engage in to comply with the settlement agreement. And so it involves tobacco sales, so that's where Department of Revenue gets involved. And then there's legal compliance work the AG's office carries out for us. So that's what those are. There have been sweeps into the state general fund just for general purposes, and over time there have been specific items that have been taken direct from key fund to other places. So it's happened every administration, both parties. There historically, it's a fund that is tempting to raid when we get more than about where we are. I mean, it feels like anything over, we're at I think 18 or 20 million in the endowment right now. Anything over that is usually when the larger sweeps happen. So we've never really benefited from the principal.
That's the beauty of a budget committee. We realize that money is neither red nor blue.
Right. Yes.
All right, committee questions. Representative Barnberger.
Thank you, Mr. Chair. Melissa, I know the reason you're here is because I expressed my frustration with the Children's Cabinet and mostly with CASA. I've done a deep dive into the key fund statutes, the statutes that created the Children's Cabinet, your funding, your annual report, everything. Mostly CASA is the reason why I'm very frustrated. Can you tell me why you feel CASA does not qualify for funding through the Children's Cabinet?
So not me, the cabinet has never made recommendations about CASA. That transfer has been since 2016 coming from the key fund out directly to CASA. The reason it has not been in the governor's budget for the last, well, this is the fourth budget she's submitted, is because of the irregularity of that transfer. And every year, the idea is it's in the judicial budget through that the fund that they get matched out of. It's a pass through to that. So this summer we sat down. I asked Justice Wall, who is the cabinet ex officio designee, to set up a meeting for us with OJA. The executive director and I and the lobbying firm that was helping them sat down with OJA, and we laid out the case, and the court explained they will not make a budget request for CASA because of their role. When there is a case in the court system being adjudicated, their take is they need to remain neutral. So they allow the pass through, but they do not want to make a budget request that they feel would put them on one side of the cases. And I have an email to that effect. So I took that back to the governor, and I have documentation to show that I have actually been trying to find funding for CASA that would be an appropriate fit. The reason the Children's Initiative, I know you want to know why Children's Initiative Fund, we talked about that with Ms. Eakins. It's the criteria for the evaluation process. We can count kids. We could get a basic count of children served. The type of service is unique to each case. And our research team took a look at CASA, both state and national, looking for a system upon which we could base an evaluation. And I have that research perspective that it doesn't lend itself because of the lack of a logic model. Ms. Eakins let me know that CASA is working on that, and I let her know that as soon as they have that kind of information that we can review, we would be happy to consider that. We've talked to DCF about whether there is appropriate funding in their universe. The secretary felt the same way, that they have such a specific role when a child is removed from home. It's into state custody effectively. And again, felt like this needs to be a neutral place for children to receive their own representation. One thought would be that, and I want to stop and note, I know there are politics involved in this, right? The Office of Child Advocate is a place where funding for the advocacy program should be married up with the child advocate that exists to play that role, to be a place for that kind of investigation. So there is a natural fit. I am open. My door is open. And if we can sit down and we can find a way that our cabinet can comply with our statutory responsibilities, I'm happy to entertain a relationship with CASA, because we appreciate the services that they provide for children who are in very difficult circumstances.
So then there was funding that was from the Children's Cabinet to the Washburn School of Law that created a 6-part webinar series for judges, lawyers, and CASAs. So I don't understand how
That
it's fine here, but it's not fine for CASA.
That was a proposal. We use an RFP process. Our child abuse prevention program, the CBCAP fund, is where that funding came from. They submitted a proposal. The cabinet granted them $28,000 to create, using their law students, the series of webinars that are free CLE classes to improve the quality of representation in the court system. It's designed to help attorneys learn more about family law and best practices and how to be a child well-being system as opposed to a child welfare system. So there is a specific purpose that meets the criteria of the community-based child abuse prevention grant funding. And as I said, the cabinet has no inherent problem with CASA and the service they provide. It's whether it's a natural fit and its participation in the grant application process that we have for programs in the state.
Okay. I also have frustration when I'm told, and I'm saying I secondhand, that the Children's Cabinet has told other organizations, you don't qualify, quit asking for money. The legislature needs to quit appropriating you dollars. But we are the ones who appropriated those dollars, and so it's just supposed to be a pass-through to get to those organizations. So can you talk about that? Because I've been told that multiple times.
Well, I don't know. I can't speak to that because I don't know who you're referring to. So the cabinet made recommendations last June that changed some of the recommendations for line items in the Children's Initiative Fund. The governor took those recommendations and implemented them. So it is changing. There are several programs that we recommended be funded in other capacities, and that was put into the governor's budget recommendation, and now it is in front of the legislature for consideration.
And another question I have is, if I were to make the request when it's time to work the budget on the floor that to do the exact same transfer again, will you just stay neutral in it? Or are you going to come out and oppose it?
I can show you, I've documented in writing on a number of occasions. I am not actively going to intervene and work to defeat such a motion because we do understand the role CASA plays. Our preference would be that we not have that transfer, and that our first request would be help them, give them state general fund dollars. Second is a request that I put into the governor's office to take a look at the governor grant office programs, and do know that they get a little bit from there. Maybe we can increase the grants so that they have the secure funding they need. So there are alternatives that we are helping explore, but no, I will not actively fight funding for CASA.
Well, I made a phone call into the governor's office to double check on, is the conversation there through the grants office, and I have yet to get a phone call back. And so to be told from some other folks that there could be a GBA for it, and then I just want to double check and not get a phone call back. You understand that's frustrating. The last thing I just want to end on, I had other things to state, but the last thing I want to end on is looking for your blueprint for early childhood. You have healthy development and strong families as two of your building blocks. I believe CASA fits exactly into that, as their mission is to train, recruit, and support volunteers to advocate for the best interests of children who've experienced abuse and neglect. You talked about abuse and neglect earlier. These are cases that have to deal with that. And I just strongly ask that your board can come to some type of conclusion, and hopefully we can find funding for CASA. I'm not wanting it to be fully state funded. I do appreciate the private side of it. I've been on a CASA local board, and now I'm on the state board. And it amazes me how so many counties in the state of Kansas don't even have a CASA program. And last year there was Sorry, I have all my stuff printed off. Here it is. Last year, there was, and this is just for the committee to understand, the number of children in foster care that remained at a crisis level was 7,443 children in care as of December 2020. Only roughly over 1,800 of those children were able to be served by local CASA programs, and there's only, as of 2020, 753 CASA volunteers. So this is a huge program. Again, I've stated before, it saves the children in foster care on average 2.5 months in foster care. It saves the state actually millions of dollars from just that little bit that we put in there. So I appreciate you coming. This is a conversation I think that we should have had offline, but at the same time, I'm hearing certain things, and it's probably through the funnel, it got a different way. But I just strongly urge, I think that CASA does fit in the children's cabinet model, and I just ask that it be considered. Thank you.
So if I may just respond, the only discretionary funding the cabinet has is the early childhood block grant. And the only way that funding is appropriated by the cabinet is through the RFP application process. That is public for programs to apply to. So happy to entertain proposals through that process. The rest of the cabinet funding that is on paper is flow through to specific programs. So Representative, my door is open. I will come to you. Let me know when and how you would like to continue the conversation, and I would be happy to have it.
Representative French.
Thank you, Mr. Chair. I'd like to go through your children's cabinet members. And thank you for being here. It's very informative. I didn't even realize this organization existed until today. So it's made up of 5 voting members appointed by the governor. Do those change when the governors change?
They have 4-year terms. So for legislative leadership and the governor alike, the terms have a start and end date based on the appointment. And the statute actually described a staggered start.
So if a governor appoints you, you're in for 4 years, even if the governor rotates out. Is that correct? Okay. And are those paid positions?
No, they are not.
Okay. And official members, that's your secretaries and their representatives, I assume.
They do not have a vote. They can advise, and so
Okay.
they're there to provide information and answer questions, and they can participate in discussion at cabinet meetings, but the voting members are the 9 appointees.
They normally attend meetings, though?
They do.
Okay. And then you have your actual staff members.
Mhm.
Are those paid positions?
Cabinet staff, yes. We have myself, we have a program director, and I have a program coordinator. So the program director is the person who coordinates and interfaces with the grant recipients.
Uh-huh.
And the program coordinator handles all of the grant paperwork.
See 5 staff members listed.
There are several positions that are fully funded by federal grant funding that are grant-related positions.
Those, I guess they're staff and they're on as long as you want to use them, right? They're not a term or anything like that. They're actually hired and they're on as long as they perform their duties. Is that
Well, the funding that funds them is a grant.
a
So
grant? Okay.
Yeah.
And so what's the grant term?
this one is a 3-year grant that is non-renewable.
Non-renewable?
Mhm.
See, some of these in 2020,
That's the grant position.
that's a grant.
Yep.
And so that grant runs out in August of 2023.
Yep.
Okay. Thank you
Which
very
isn't to
much.
say we won't find another grant to apply for, but they are tied to grant funding, not state general fund and not CIF funds.
Thank you very much.
You're welcome.
Right. And Representative, don't feel bad about not knowing that the Children's Cabinet existed. I have known about the Children's Cabinet for a long time, but this is the first time I've gotten this much information about it. So you don't have to feel bad about that at all. Questions? Seeing
That
none.
was easy. Representative already mentioned our website is our hub for information. So there is a drop down that is specific to the grant activities. That's called All In for Kansas Kids. That's where you will find our comprehensive needs assessment, our 5-year strategic plan. That work is all in partnership with our 3 sister agencies. And then there's Children's Cabinet related materials. Our annual report can be found there. I have hard copies of things. We print a limited number, but I can get more if there's demand. I like paper.
They're about 8 foot by 8 foot.
I know, right? But if any, I don't presume to just come hand out our reports, but if anyone would like to have a copy of the report, I'd be happy to provide it.
Thank you for being here. And committee, this is the only thing standing in the way of a 4-day weekend. So I'm not going, and snow. Yeah, you don't have to use that sort of language in my committee, Representative French. But, but I'm not going to drag my feet. Currently, we have no further meetings scheduled for this committee. You'll see on your calendar, they'll be marked as on call of the chair. You never know when something might pop up, but I don't see anything at this time. So, oh, that's right. You should have and it's right here on my schedule here, and I didn't do anything about it. You should have also received the minutes from the March 8th meeting. I would entertain a motion to approve those minutes. So Representative Amix moves, Representative Arnberger seconds. Discussion on the minutes. No. All right, all those in favor say aye. Opposed? Very good. With that, committee, until further notice, we are adjourned.